Hello friends, welcome to Medicine of One. Today we'll talk about the Parkinsonism. Okay, so here basically we'll talk about from the pharmacological aspect, what type of the drugs we use in case of the Parkinson disease. Okay, so before going to the Parkinson's drugs, let's have a look. What is Parkinson's? So what is Parkinson disease? Basically, we know it's a neurodegenerative disorders. Okay, neurodegenerative disorders in the basal ganglia. So it's a neurodegenerative disorder in basal ganglia. Hope you know the structures of the basal ganglia. Okay. What type of the clinical manifestations we'll see over here? Whenever the degenerations will be over there, then we'll see the various types of the clinical manifestations of the patients. For example, we can say the tremors. Okay, just thing like this we will see. Uh, slow movement also, or hypokinesia you can say, slow movement. The fine term you can say hypokinesia. Just like this, basically we see in case of the old age. This type of the disease is found in case of the old age patients. Okay, so with these types of the clinical manifestations, like the tremors, we can see the slow movements. Okay, or we can see also the rigidity, and also the rigidity. Okay, this type of the clinical manifestations we can see over there. Now, what's the main problem over here? The main problem is that on top of the neurotransmitter, we know there is a dopamine. In this disease, the dopaminergic activity that will be very less. So we can say the dopaminergic activity that will severely decrease. Why? Because we are getting already here that is the neurodegenerative disorders. Whenever the neurons or the nerves are getting damaged, as a result, the productions of the neurotransmitter in terms of the basal ganglia, we can say over here the dopamine that will be very less. So as a result, we will see these types of the consequences. Okay. Now normally we know that the dopamine and the acetylcholine, these two types of the neurotransmitters, they are having the balance within them. Okay. Now for example, if I say that we are having the 100 molecules of the dopamine, similarly we are having the 100 molecules of acetylcholine. Now, whenever we are seeing the problem, the neurodegenerative disorders in the basal ganglia, as a result, the dopamine activity or the number of dopamine neurotransmitter that will be less. For example, if I say over here there is right now 40, but still there is no changes in the acetylcholine. It is same as the previous one. Okay, so 100. Now, if we see that this imbalance will be here, that let me just show within these terms. So there will be an imbalance in between the word dopamine and acetylcholine. So this type of the imbalance we can see over there. Okay, let me recap this part over here. Okay. Now we'll talk about how the dopamine is getting formed. How the dopamine is getting formed. Okay. Let me tell you, first of all, we know these structures that it's like this. Okay. To form the dopamine, the precursors we can get over here, the tyrosine amino acid, we know all of it. Okay, tyrosine. The tyrosine that will be taken by some active transporter over there on the membrane. So the tyrosines will come over here. I'm writing tyrosine. Okay. Now whenever the tyrosines will come over here, that will be acted by one enzyme that is known as tyrosine hydroxylase. So the name of the enzyme tyrosine hydroxylase. Now the tyrosine will get converted into what? Dopa. Okay. Now this dopa will be acted by one more enzyme that is known as DD, or you can say dopamine decarboxylase. Let's get dopamine decarboxylase or dopamine decarboxylase. Then it will get converted ultimately within the dopamine. Then we will get the dopamine, and it will be stored ultimately within the vesicles with this dopamine neurotransmitter that is getting from, ultimately we know like the other neurotransmitter, it will be stored within the vesicles. Now whenever the nerve impulse will come over here, whenever the nerve impulse within the nerve impulse, there will be water. This will come over here. This will come as a result of what? The cationic influx over here, the sodium, the calcium, voltage sensitive calcium channel will get opened, there will be influx of the calcium. Many things are there. So I have a separate video for this one, for the neurotransmitter, transmissions from this presynaptic to postsynaptic. You can watch over there later. Now this in these vesicles will come over here, then this vesicle will fuse just like this. Okay, and their neurotransmitter like dopamine that will be released out. Now we know there are also certain types of the receptors that is present over here on the postsynaptic membrane. Okay, then this dopamine will come over here and they will get bind with their receptors. Similarly over here. Now this type of the normal things we see under normal physiological circumstances. Okay, under normal physiological circumstances we can see over like this. Okay, now we are seeing in the Parkinson's disease that the amount of the dopamines, or we can say the releasing of the dopamine from the vesicles, that will be severely less. Now if you want to treat the things, then we can do in several ways. Before going to that, whenever the dopamine will be here, this dopamine will not act for longer durations, just normal. It will come whenever it is needed, and after doing its job, it will get destructed. So there are two types of the enzymes that is always ready to get destroy the dopamine over here. One is MAO, and this MAO means what? Monoamine oxidase. Monoamine oxidase. Okay, and this one is catechol orthomethyl transferase. Catechol orthomethyl transferase. Okay. Now if we talk about the drugs, what type of the drugs we can use? We can use, first of all, we can give the dopamine from outside. First things, okay. The second thing is here that we can give the drugs which can activate the vesicles, number 2, to release the dopamine over here. Number 3, we can use the drugs that will inhibit these types of the enzymes. Whenever these enzymes will be inhibited, as a result, we can see the activity for the dopamine that will be increased. The durations or activity of the dopamine that will get increased because these types of the enzymes are getting inhibited. And the number 4, we can directly stimulate the receptors of the dopamine over here. So the 4 types of the drugs we can use in these cases. Now first we will talk about the from outside you can give the supplement of the dopamine. Now whenever, if we talk about the first one, if we talk about this first point, so we will give the dopamine from outside. We can use the dopamine from outside, but the main problem is over here. Whenever we use the dopamine, we need the main functions within the brain, but this dopamine is not able to cross the blood-brain barrier. Okay, if I show you the structures of the blood-brain barrier, I'll just see it over here. And for example, the blood-brain barrier I am forming with this one. Okay, now what? Ultimately, we will see the dopamine will be taken by the patients, but this dopamine will be not able to cross the blood-brain barrier. As a result, it will not be effective for the patients. Now, as a precursors of the dopamine, we can use the L-dopa or levodopa. So we can use for this purpose the levodopa or L-dopa. That's the precursor of dopamine. Okay, this L-dopa can cross the blood-brain barriers. So whenever we are using the L-dopa, for examples, it's coming over here. Okay, now the L-dopa that will be acted by same enzyme DD, dopamine decarboxylase. Then it will convert the L-dopa into dopamine. Then the dopamine will be able to work over there. But the main problem is over here that we know that whenever using the L-dopa, it is going within the CNS. Similarly, it will also go in the peripheral systems. Okay. So it will go also the peripheral systems. Whenever it will go to the peripheral system, whatever the problem we will see, in the same way, L-dopa will get converted into dopamine. Now, we know that whenever the dopamine will be active on the peripheral system, the dopamine is having the various types of the receptors over there. So if we just talk about the in terms of the receptor D1, we will get the alpha 1, we will get the beta 1 receptors. The main problem will be over here that whenever the D1 receptors will be activated by the dopamine, it will leads to formation of the vasodilation. So whenever the vasodilations will be there, definitely we will see the hypotension. In the same way, this dopamine will be acted on the with alpha 1. So as a result, you can see the alpha 1 receptors present on the blood vessels that will be responsible for causing the vasoconstriction. So whenever we get the vasoconstriction, that will lead to the hypertension. Okay, and the beta 1. So whenever the beta 1, we know the adrenergic receptor over here in the heart, that will be activated by the dopamine. So as a result, they will see the tachycardia. The heart rate that will be greater than the normal. Okay, or tachyarrhythmia. Whatever thing we can say over here. But we didn't expect these things. Our main focus was to act within the central nervous systems, within the brain. But we know that the dopamine will also able to work on the peripheral systems. As a result, this type of the side effects or adverse effect we have to tolerate here. But the main problem over here that we have to choose such a drug that will not act on the peripheral system, that will act only within the central nervous systems. Okay. Now these types of the drugs, if you can use, then that will be the activity of the dopamine that will be limited within the central nervous systems. The dopamine will not be able to work further on the peripheral systems. Okay, what types of the drugs are there? You have to know the names of the drugs. So the drugs that will act only within the central nervous systems, they will not act further on the peripheral systems. One is carbidopa. Okay, now if we use the carbidopa, this drug, then whatever the facilities we will get, this carbidopa, activity of the carbidopa will be only limited within the central nervous systems. The carbidopa will be not able to work on the peripheral systems. As a result, these types of the manifestations will not see over there. Okay, so we can use the carbidopa over there. Along with that carbidopa, we can use one more drug, benserazide. So these two types of the drugs we can use just to avoid these conditions over there. Okay. Now the second groups of the drugs we will use where there are certain types of the drugs that can activate with the vesicles. And when the vesicles will be activated, within what the neurotransmitters are deposited, whenever it will be activated, this will release the neurotransmitters. So the activity for these things will be increased for the dopamine. Okay. Now second groups of the drugs we can use over here. Drugs boosting activations of vesicle. Okay, what type of the drugs we can use over there? Let me write the name of the drugs. There are certain groups of the drugs. Amantadine. So you can use amantadine, this type of the drugs. In this cases, that will activate only the the vesicles, and whenever it will be activated, this will release the more amount of the neurotransmitters. So more amount of the functions will be over there. So the symptoms that will come down, not that much severe symptoms will see further. Okay. Now the second thing or second test of the things we can see over here, where we did talk about there are certain types of the enzyme inhibitor drugs. Okay, there are certain types of the drugs that will inhibit the enzymes. As a result, these enzymes will be not able to destroy the dopamine. So the acting durations for the dopamine that will get increased. So let me write the name over there. If we see the monoamine oxidase inhibitor, there are two types of the monoamine oxidase inhibitor. MAO-A inhibitor and MAO-B inhibitor. That means monoamine oxidase A inhibitor, monoamine oxidase B inhibitor. Okay. Now, the activity of the monoamine A, it will be found in the different tissues and the different organs. So it can metabolize all substances. Metabolize all substances, especially the present in the liver, spleen, kidney, many places. Okay, I'm not writing all of them, but whatever this, what the main advantage for the MAO-B or the monoamine oxidase B inhibitor here we will get, that is limited for the activation within the brain. Its activity is limited within the brain, MAO-B. Okay. What types of the drugs will get? Selegiline. Okay, so within the MAO-B inhibitors, if we just compare and contrast in between them, this will also act within the brain, but this is only within the brain, but this will act along with the brain for the other organs also, other tissues. So if you are said to choose which types of the drugs we should use, definitely we are supposed to choose the which one? MAO-B inhibitor over here. Okay, that's the main thing. Then you can use or rasagiline, over here. There are types of the drugs further we can use. Cephinamide. So these three drugs we can use in terms of the MAO-B inhibitors. Okay, that will be helpful over there. And here, if we talk about the MAO-A inhibitors, here we can use the entacapone. Let me write with this one. We can use the entacapone. We can use the also OP. Over there. Okay, so these types of the drugs we can use. Now I'll talk about the adverse effects or there are some problems. Okay, in terms of the first group drugs, I talk about what? The carbidopa. Okay, where we just use the supplementations from outside. Now if you give the L-dopa or whatever, you can see the carbidopa over here in the excess amount. For example, the patient needs 10 grams, but onset day, but we are using 50 gram over here. So as a result, whatever the problem we will see over here that the dopamine, I'm writing a dopa, that will be much more with respect to the acetylcholine. With respect to the acetylcholine, the dopamine, that will be much more. Okay, as a result, whatever the problem we will see, definitely we will see the problem related to the hallucinations. Okay, or psychotic problems, or you can say the psychosis. You can see over here. You can see the psychosis. There will be changes within the behavior of the patients. Okay, so you can see the hallucinations. You can see the behavioral changes. The behavioral changes will see for the temporary period of these things. Then whatever the drugs or how should be the dose for these things, we know that within the neurons, let's for examples, if we see, as it's the neurodegenerative disorders, for examples we had first that 100 neurons, for examples with this, where the dopamine could deposit it, okay, but main problem over here, let's suppose the 50 neurons are activated right now. There are 50% of the neurons of the basal ganglia are active right now. Then whenever we are using the dopamines or L-dopa, the precursor drugs, then this will come over here and it will get deposited over here, just like this. Now whenever the first neurons, it will release the dopamine, it will act for 2 to 3 hours, for examples. Then whenever its activity will be done, then the second neuron will come in working, okay. Then whenever it will be done, this neuron like this, subsequently all the neurons will secrete the neurotransmitter. So if we use once a day, then it's enough for the patient. Okay, that's the main thing here. Now we have to know that what is on-off phenomenon. Yes, it's important. On-off phenomenon. On-off phenomenon means, for example, whenever we're using the drug, okay, whenever you're using the drugs for 2 to 3 hours, the symptoms that will get disappeared, the patients, okay. But if we see after 2 to 3 hours, again the activities, or you can say these types of the symptoms again reappearance, okay. Then we can see these things the off, okay. So these two types of the thing we will consider in terms of the on-off phenomenon over here. For example, if we see out of 50 neurons, I already said out of the 50 neurons are active right now. Out of 50 neurons, if I see only now right now day by day, for example, 13 neurons activated, then 20 neurons, then 10 neurons, just like this. So whenever the amount of the neurons or the number of neurons will get decreased day by day, we will see over here the changes. This all the neurons will have not that much capacity to store the neurotransmitter within them. As a result, we will see the persons will have the severe problem. Okay, at that time, whatever the drugs we can use, if the person's conditions will not get better, that's the main problem over here. So for that reasons, we have to make sure that whenever using the drugs, the dose should be maintained as per the physician will say over there. Okay, that's the main solutions over here. And let's see anything is left over here or not. One of your phenomenons we did. Okay. Yes, so that's all for Parkinsonism. I think if you can remember all these drugs and how the process are going through these mechanisms, or how these things dopamine is getting formed, even though it's the physiological part, but you can remember from here as well. Well, so these types of the drugs are used over there. Okay, so if you don't get any point, let me know in the comment sections. I'll try to help you guys with my level best. Okay, and if you just like the video, please don't forget to subscribe my channels and just do support. Thank you for